Hi, this is Dr. David Tenner. We're here at the Goldberg Clinic for chronic disease reversal, and we're here with one of our favorite little guys, Mr. Anderson Guerreros, and his mom, Dawn. And Anderson has quite an interesting story to tell. And so, Anderson, tell us a little bit about the kind of health problems that you were having and what brought you into the office.
Well, when I was a little kid, my knee was very big, so we went here, and I haven't had a flare-up since I started this thing.
No flare-ups at all, huh?
Mm-hmm.
So you're an active little guy, and you're out there playing baseball and having a good time. Your knee was pretty swollen originally, wasn't it?
Yeah.
And you were having a hard time, having a lot of knee pain. You couldn't really participate in all the things you wanted to. Well, I'm glad to hear that Anderson's doing much better. We did some great things to help him along and correct what was causing his problems. But prior to coming in, Anderson was being seen medically, and they were kind of leading him down a certain path, quite different from what we had recommended. So, Mom, would you tell us a little bit about your experience in that regard, the recommendations that they had made, the reasons why you decided not to follow through, and then the kind of things that we did to help him along as well?
Absolutely. Anderson was diagnosed at the age of 2 with Juvenile Rheumatoid Arthritis in his right knee. His knee on an average day kind of looked like there was an orange inside the knee, so it was very bulbous, very swollen, warm to the touch, a lot of fluid, and it had been that way for multiple years. He was on multiple NSAID medications and stomach medications to help with the pain and the inflammation in the stomach. And we were going down that route for a long time. We did 2 doses of steroid injections in the knee to try to help with the inflammation. Neither of those treatments worked for him. They didn't last but a couple weeks. So we got to the point, he's now 7, this started at 2, so we got to the point this past spring of 2013 where they wanted to do another round of steroid shots, which we didn't feel was really necessary since the first 2 rounds did not work. And they wanted to start talking about putting him on Enbrel and do weekly injections to help counteract what was going on with his knee and the deterioration of the knee joint because of the inflammation, the constant inflammation of over the past few years. Basically, my husband and I got to the point where we decided we did not want to go down that route. We didn't want to do more injections. We weren't getting any results. We were treating the symptom and not the cause, and we decided to find someone else that would listen to the path that we wanted to take. And I did some research online and found a lot of food-related issues, and then found the Goldberg Clinic and made an appointment and came to see Dr. Tenner and Dr. Goldberg. And they took it from there, and they ran a bunch of tests on Anderson and came back with results that were very conclusive to things that seemed to be causing the problem. And from there, we followed the direction, and his improvement has been tremendous. From weight gain to height growth to activity level to no pain anymore to no more medications whatsoever to not a single flare-up since August, and we are now in the end of October. So a complete turnaround, basically, from the status that he was at.
Anderson's story is quite remarkable. We unfortunately see a lot of children in Anderson's situation having been diagnosed. He was diagnosed with juvenile rheumatoid arthritis.
Yeah.
And the general recommendations or the treatments for those medically typically involve things like steroids and then eventually Enbrel, which, as we've seen over the years, and Dr. Goldberg has over 35 years, has seen the devastating effects that those drugs can have on people, not just adults, but on children. Some of the common side effects, particularly with Enbrel, and young guys like Anderson's development of cancer and things like lymphoma over time. So not only has Anderson gotten well and he's thrived as a result, his knee swelling's down, he's playing baseball, he's playing first base, that's right, for the Boston Red Sox in the Little League.
Horrible.
Yeah, but he's been able to avoid all of the hazardous side effects that would have resulted from some of the medications that we commonly see in a lot of children and adults. So, and we pinpointed some of the factors that had resulted in the symptoms that he was experiencing, the condition that he manifested, and we set him on the right course. His body has responded beautifully. And so now we can watch this young man thrive and grow up into a healthy and very happy adult. And so we're thrilled with how he's doing, and we look forward to just continuing the progress from this point forward. So Anderson, give us a big thumbs up there, bud. That's right. And thank you, Mom, for sharing this story. We appreciate it. And like I said, we look forward to continuing to work with you both in the future.
Wave bye.
Wave bye.
Bye!